Hi, this is Sarah McLeod, your host for Proven Cures, and this discussion is going to be about chronic kidney disease. I apologize, normally I am dressed professionally, but I'm actually on vacation. And yesterday, one of my IG followers asked me to do some research for him on chronic kidney disease. So this entire discussion is actually going to be about stopping the inflammatory process associated with the progression of chronic kidney disease. If this is something that is of interest to you, perhaps you're suffering or you know someone, please write down the following. The word is curcumin, Curcumin, and also the extract that it can be found in, turmeric, Turmeric. If you can get a purified turmeric extract of 824 milligrams taken twice a day for at least 8 weeks, it will stop the inflammatory process associated with chronic kidney disease and thereby ameliorate the condition itself. Now I'm going to jump into the study. The title of the study is Curcumin and Chronic Kidney Disease, Major Mode of Action Through Stimulating Endogenous Intestinal Alkaline Phosphatase. It was published December 2nd, 2014 in a journal called Molecules. The study itself was conducted at Virginia Commonwealth University Medical Center's Division of Nephrology by researchers Siddhartha S. Ghosh, Todd W. B. Gayer, and Sobha Ghosh. I hope I didn't mess up the pronunciations of those Indian names. Well, according to this study, chronic kidney disease, or CKD as it is often referred to as, is actually an inflammatory condition. And so in order to stop the progression of chronic kidney disease, you have to stop the inflammation. That is the bottom line, the hypothesis of the study. And unfortunately, if the inflammation is not brought under control, kidney disease will only get worse and result in end-stage kidney disease, leading to the necessity for dialysis and a kidney transplant eventually. So a lot of patients diagnosed with kidney disease in the Western Hemisphere actually suffer from something that seems to be totally incurable. And it actually lowers the body's ability to eliminate soluble waste, causing a buildup of uremic toxins in the body. Now, the reason for this is because both CKD, a condition called diabetes, and atherosclerosis of the heart are all associated with a decreased expression of tight conjunction proteins and intestinal alkaline phosphatase. Okay? So the unfortunate reduction in IAP, the intestinal alkaline phosphatase, and the junction proteins in the intestines actually increases the permeability of the gut. Now, what this means is that pro-inflammatory molecules that are naturally created within the intestine that cause inflammation, called cytokines and lipopolysaccharides, actually are easily passed through the lining of the intestine into the bloodstream of people who have kidney disease. So researchers put a traditional herbal spice called turmeric to the test because it is high, purified turmeric rather, is high in curcumin. So actually, like I was saying in the earlier part of the video, if you are going to go and purchase turmeric, you want to buy a purified extract that actually is purported to have 95% curcuminoids in it. That is how you will get benefit from the anti-inflammatory activity of the curcumin. So researchers did find, in fact, that curcumin stops the generation and action. So it stops the production and the ability to cause inflammation of both the cytokines and the lipopolysaccharides, thereby completely ameliorating chronic kidney disease and stopping the progression of disease. So if you're at stage 1, if you're at stage 2, if you're at stage 3, and you get started on this regimen of curcumin, turmeric extract with 95% curcumin, 824 milligrams twice per day, you can stop the progression of your kidney disease. So for this study now, specifically 16 patients with chronic kidney disease who were also showing to have protein in the urine on lab tests were recruited. Okay, half were given enalapril, which is an ACE inhibitor, which is normally prescribed in the traditional therapy of chronic kidney disease, and the other half were given the curcumin at the dosage that I said, the 824 milligrams twice per day in a turmeric extract, of course, 95% curcuminoids. And that was done for 8 weeks. At the end of the 8 weeks, researchers found that the curcumin was just as effective as enalapril in reducing the inflammatory cytokines, 2 of them specifically. The one is called tumor necrosis factor, it's also referred to as TNF alpha, and the other is interleukin 1, also referred to as IL-1 beta, and the curcumin effectively abated both the proteinuria, the protein in the urine, it stopped it, and kidney injury. And this was manifested by tubular interstitial injury and this word just trips me up all the time, glomerulosclerosis. Okay, so these patients also, as co-benefits, experienced a decrease in their body mass indices and blood pressures with reduced systolics within 15 days of curcumin therapy. It is well known that people who have stage 3 kidney disease also normally suffer from hypertension. So these individuals, if they're able to start the curcumin at the 824 milligram, the turmeric extract with the 95% curcuminoids at 824 milligrams twice per day, also will receive the added benefit of reducing their hypertension. It is noteworthy for me to mention, however, that the traditional biomarkers of chronic kidney disease, the lab biomarkers of creatinine and BUN, blood urea nitrogen, those numbers did not change on lab tests. Okay. But I will tell you that reducing the inflammatory molecules, the cytokines, and the lipopolysaccharides were not the only significant benefit found with supplementing with curcumin. People with kidney disease are essentially trapped in an inflammatory cycle. You see, when the kidneys are inflamed, the immune system sends cells known as macrophages and leukocytes to the site of the kidney injury, okay, trying to help the kidney. But instead of actually helping, what this does is cause the macrophages and the leukocytes actually cause oxidative stress in the already injured kidney, which leads to further inflammation of the kidney cells. And the kidney tries to compensate for that by creating mediator proteins such as more cytokines, chemokines, and metabolites of arachidonic acid. These cause the immune system to release even more macrophages. So this literally creates an inflammatory chain reaction in the kidney. Curcumin was found to stop this chain reaction by blocking xanthine oxidase expression, stopping oxidative stress completely, and thereby improving kidney function. So researchers also mentioned that stopping the production of cytokines and chemokines is capable of preventing the onset of heart failure. So that is the conclusion of this discussion. It is very well worth it if you are at some stage of kidney disease and you're very afraid, you're staring down the barrel of end-stage renal disease, eventually dialysis, maybe having to get a new kidney. Turmeric is a spice. It's a dietary spice. It's been used for centuries in other cultures to spice up food, and it can very well be worth it for you to just get the supplement and give it a try yourself, just to stop the progression of the disease and stop the inflammation in your kidneys. Okay, I hope you found this helpful. Thank you for watching. Please share this video like, and subscribe to Proven Cures. Once you subscribe, make sure to hit the notification bell so that you can be kept abreast of all the new videos that I create. And once again, thank you very much. Have a good one. Bye-bye.